All right, welcome back, everyone. So local patients are lining up to get vaccinated and still tested for COVID-19. In fact, Avecina Medical Urgent Care is seeing the highest volume of COVID-positive patients, even when you compare the numbers to the peak of last year. So here's some perspective. Between the three clinics, they consistently saw about 100 to 130 patients a day back in 2020, with only 12% of them testing positive. So let's fast forward. Right now, testing about 150 to 160 patients a day, and more than a quarter, 25% plus, are testing positive. Dr. Saman Soleymani with Avecina Medical Urgent Care joins us today. You reached out to me last week about this story, and you're seeing the trend. Can you pinpoint when it exactly started?
We saw the uptick about 3 weeks ago.
Okay.
Somewhere around 3-4 weeks ago, there was a couple of months period that things had slowed down. We were still seeing positive patients, but nothing like what's happening now. Our positivity rate has gone consistently over 20%, and like you mentioned, on days greater than 25%. Last Sunday, I had gone to work at, help out in one of my offices, and the first 15 patients that I saw, like 9 of them were positive.
Wow.
So it's now you're seeing a lot of patients that are just sick. Last year we saw a lot of asymptomatic positive patients, but now, there's really no flu going around in July or August. So when you see someone that has allergy symptoms, they're congested, they're coughing, sore throat, like if they were symptomatic, they were positive.
Wow.
That's how.
So that's a little more helpful, because then you can judge, maybe this is the time I need to get tested, even though before it was like, okay, you had a lot of people who were asymptomatic.
Correct, because before, we would wait to see. Now, if patients are symptomatic, we're preemptively even starting treatment on them, even in the couple of hours it takes for the results to come back, because we're almost so confident that you're, especially if someone even mentions that they had an exposure to somebody else and they're symptomatic, you can kind of bet the farm that they're going to have it.
Let me ask you a question, because, we've done a lot of town hall meetings. We've invited our viewers to ask us questions. A lot of them have said, people like you, could someone, their doctor, give them the vaccine, and that might persuade them to actually get vaccinated. Do you think that would help, and you see that in the future?
So, vaccines for so long were controlled by government and government channels, such as, Public, CVS, Walgreens, that they were not even available to, local level physicians. And now that it's available, we're so busy just treating and seeing the sick patients that are in that we really almost don't have time to vaccinate. And thank God that there are many other sources and avenues for people to go get the vaccines. But for us, having the staff in place, we're better suited to actually take care of patients that need services of being that are sick, that need treatment.
Yeah, let's talk about schools, because, I have a 9-year-old, I have a 6-year-old, and I'm very concerned. They're saying you don't have to wear masks. There's certain limited shielding, like in Duval County, they'll have shields for the younger kids, and St. Johns County, no shields. What do you think this is going to look like as it plays out in the fall? It's
hard to tell, but the one thing that is great is that kids have just a tremendously better immune system than us older adults. And this is why you really do not see the morbidity and mortality in kids. We see kids in our offices all the time, and they test positive, but they're very mildly symptomatic. Now, obviously, kids that have, immunocompromised situations, severe asthma, anything that kind of makes them more riskier to COVID-19, those parents need to make a personal decision and have discussions with their family physicians or pediatricians to decide how they would move forward. But I have 2 kids myself, younger, and it's hard enough to get adults to wear masks. So, telling a 4-year-old or a 7-year-old to wear a mask all day, I just don't see how that's going to work out, because their compliance is going to be non-existent.
Well, you know what? They did it last year, and I know my kids are real vigilant about it. So, it's obviously a parental decision. Just real quick, I know we need to wrap, but, you were pointing out that anytime a virus mutates, it's just, it's nastier. You wouldn't talk about it unless it was. And we are seeing it in younger children as well.
Yeah, so the original COVID-19 had what's called an R0 value of 3, which means the virus, once one infected individual can infect 3 people. So that's what an R0 value is in epidemiology. The Delta variant has an R0 value of 8, which means that one infected individual can infect 8 people, and imagine those 8 infect another 8, so
Right,
it propagates
yeah.
through the population
Good
at a
information,
much
yeah.
faster rate.
That makes sense. That helps us understand it. Thank you so much for talking
Absolutely.
with us. You guys keep up. I know you've changed some protocols in the office.
It's by
so,
appointments
yeah.
only. All testing and treatments by appointments only through Avecina.com.
All right. And again, you're still doing that testing, which has been so important during the whole pandemic.
Thank you.
Bruce, over to you.